Hi, welcome to this product knowledge training from Florida Technical College. Today we will be talking about the Diploma in Medical Assistant Technician program with emphasis in basic X-ray. This program can be completed in a total of 12 months, 48 weeks. The program includes 11 courses and an externship of 100 hours. The total credits of this program is 62 quarter credits. There are certain admissions requirements for this program. One is proof of graduation. The second is a background check, and students must also sign a disclosure for healthcare provider programs. Applicants in our healthcare provider programs, including the medical assistant with emphasis in basic X-ray, must complete a student attestation of understanding that criminal and/or health background may limit or prevent employment in healthcare provider fields. In addition, the applicants must consent to a background check. Applicants who have a misdemeanor or felony will be evaluated on a case-by-case basis and be determined either approved for admittance or not by the executive director. The program is available in a hybrid modality. That means that it has both online and blended courses available. This program is also available at our DeLand, Kissimmee, Lakeland, Orlando, Pembroke Pines, and South Miami campuses. The Medical Assistant Technician with emphasis in basic X-ray diploma prepares students with the knowledge and skills to perform medical assistant with basic X-ray responsibilities. The student will acquire the necessary skills to perform under the supervision of a physician to provide medical office administrative services and perform clinical duties, including patient intake and care, routine diagnostic, and basic X-ray procedures. Students will be able to prepare the patient for various examinations, including X-rays, electrocardiograms, and phlebotomy. Graduates will be able to sit for the basic machine operator licensure, to be discussed later in this presentation. As mentioned earlier, this is a 12-month program, so our students must complete a total of 12 courses. The first three courses, bold in the top, medical office procedures, Anatomy and Physiology with Medical Terminology 1, and Anatomy and Physiology with Medical Terminology 2, are programs that are available in our online modality. So students will start the program in an online course. The subsequent courses, Clinical Procedures, Laboratory Procedures, Introduction to Pharmacology, and Basic Cardio Procedures are available in the blended format. Therefore, students must return to campus and work both online and also have hands-on laboratory experiences on campus. The next two classes, after they've completed their clinicals, include preparation for their certification. This is for their medical assistant exam. Once they complete this course and pass their certification exam, this course is available to them online. They will also work together with their externship coordinator to be placed in an externship in order to practice their medical assistance skills. At the completion of those 9 months, students then must return into the blended courses where we will then begin to teach them about basic machine operation. There are 3 courses under this category. The first is the Fundamentals of Basic X-ray Machine. Then we have Advanced Fundamentals of Basic X-ray Machine, followed by, which is the last course, the Basic Machine Operator Exam Preparation. There may be students who have graduated from their MAT diploma program that want to ladder into this program. And students that are interested in this may go directly into the BMO classes. Now let's discuss the program competencies. Program competencies are the skills and knowledge that students will have once they graduate from the program. Our program has 6 competencies. The first, students will demonstrate the use of canons of professional ethics, social norms, government regulations, and the Health Insurance Portability and Accountability Act laws governing the practice of medical assistant technician with emphasis in basic X-ray. Students will examine the economic, cultural, social, and political environment of different medical settings, including hospitals, medical offices, and other healthcare centers to adapt to the diverse medical situations. It will develop effective communication, oral and written skills that are appropriate in the professional context of the medical field when working with electronic medical records and communicating with patients, healthcare providers, physicians, and other healthcare professionals. Students will also apply professional knowledge and skills critically and creatively in a medical setting when assisting the physician and dealing with a diverse patient population. In addition, at the completion of the program, students will be able to consider and logically interpret the information provided by the healthcare professionals to assist the physician and patients with different procedures, including X-rays, EKGs, and phlebotomy. They will examine and employ strategies for infection prevention and control and radiation safety measures according to the different situations following the standards of the Occupational Safety and Health Administration. Now that we've learned about the program competencies and how those align to our institutional learning goals, let's talk about the program course descriptions and learn about each course in detail. The first 3 courses are online courses. You have medical office procedures. In this course, students develop the skills related to medical office administrative procedures. They use electronic health records, schedule appointments, handle mail, billing and collecting, and prepare budgets. In this course, they also begin to practice the acquired skills by completing certain practical lab exercises in preparation for their certification exam. Anatomy and Physiology and Medical Terminology 1 and 2 are courses that help the student examine the anatomy and physiology of the human body, as well as the related medical terms and abbreviations. These combo courses provide students with the foundational skills that they need in order to continue into their clinical labs. Students continue to practice the acquired skills in order to complete not only the lab exercises, but also in preparation for their certification exams. These courses can be taken in any order. Students may begin in either the medical office procedures class or in any of the anatomy courses. The laboratory courses are available on campus in a blended modality. This is where the students learn the traditional medical assistant technician responsibilities. These courses include laboratory procedures, introduction to pharmacology, basic cardio procedures, and clinical procedures. In these lab courses, students will analyze practical clinical skills for working in a medical office environment. They will explore patient education and medical history, focusing on effective communication skills. Furthermore, students will assist healthcare staff in taking patients' vital signs, physical examinations, and various treatment modalities. They will also perform laboratory procedures and evaluate specimen collection methods. Students will analyze the basic rules of preparation and administration of oral and parenteral medications. Students will analyze commonly performed cardiovascular and pulmonary function studies, as well as daily functions and responsibilities of a medical assistant technician. In addition, they will perform cardiorespiratory procedures such as a 12-lead electrocardiogram without artifacts, as well as first aid and basic life support procedures. At the completion of their clinicals, students will be enrolled in the Certified Medical Assistant Exam Preparation course, which is available online. In this course, students will reinforce their knowledge of the topics and practical skills that they've learned throughout their medical assistant technician portion of the program. This is a culmination of all the courses, and all previous courses are prerequisites before students can enroll into this exam preparation course. Students will evaluate medical assistant administrative and exam room tasks, the electronic health record, which is the EHR system, the information required to complete the medical records as well. Students will analyze the influence of nutrition in patients' health and the importance of pharmacology concepts and procedures. They will also examine the basic cardio, phlebotomy, and laboratory procedures. And they will practice the acquired skills by completing lab exercises in preparation for the certification exam. And of course, all of this is done in anticipation of enrolling and starting their externship course the following month. The externship course is an on-location course. During their clinical procedures experience, our students will be visited by externship coordinators who will begin to prepare them for an externship assignment. The externship is a course. Students apply all of their administrative and clinical skills obtained throughout the program at an approved externship site. They begin to also continue their hands-on experience in the healthcare setting, where they work under the direct supervision of a clinical professional. Furthermore, they demonstrate their clinical skills while working with patients, doctors, and other members of the healthcare team. As students participate in this 100-hour externship, they will be evaluated by the clinical professional and also by their externship coordinator. Once students complete their externship, they are then invited to come back to campus to complete their basic machine operator courses. The basic X-ray courses consist of 3 courses. It's 3 months. And here, students develop the technical knowledge in the fundamentals for the use, maintenance, and storage of X-ray equipment and radiologic film and image production. They examine transferring and positioning techniques and relevant anatomy for radiological studies of the upper and lower extremities. They analyze ethical issues, legal requirements, principles of professionalism, and effective communication skills necessary in the healthcare workplace. They utilize the regulatory agencies to study those standards, focusing on reducing the spread of disease and infection control. And they explore topics covered in the Florida Health and the American Registry of Radiologic Technologists certification for basic X-ray machine operator, such as patient care, safety, image preparation, and procedures. The last course is focused on exam preparation and preparing students to begin to complete their applications for submission so that they may obtain their licensure. There are 2 certifications that our program prepares our students for, and the cost of these certifications are covered in our program. Our students learn the hands-on patient care skills necessary to become a certified medical assistant and prepared to take the National Certified Medical Assistant NCMA exam by the National Center for Competency Testing. In addition, program graduates are eligible to take the Florida Basic X-ray Machine Operator Examination administered by the American Registry of Radiological Technologists, or ARRT. For more information about the program, I welcome you to visit our college catalog at www.ftccollege.edu. I also encourage you to speak to your Dean of Academic Affairs and program coordinators of the program and schedule a tour of the classroom and further product knowledge regarding the Medical Assistant Technician with emphasis in Basic X-ray Diploma program. In addition, please visit the Student Consumer Information section available in our website. Thank you for participating in this presentation. Please complete the survey at the end. In addition, for your certificate of completion for your records, please complete the Product Knowledge Short Quiz. Once you earn a 70% or more, we will email your certificate within 5 to 7 business days. We appreciate your time. Have a wonderful and productive day.